presenter we have Dr. Ragini Pundir. She will be discussing about dry eye in children in Tertiary Care Center. And next in line we have Dr. Purva Bhatt.
Good morning, everyone. I'll be presenting on the topic, a study of dry eye in children in a tertiary care center. Dry eye is a multifactorial disease having a number of different interacting causes or influences. It is depicted by a loss of homeostasis of the tear film in association with ocular symptoms. Worldwide, it is emerging as an important cause of ocular morbidity, especially amongst the young population. Increased on-screen time and near-view work results in reduced blink rates and incomplete eyelid closure, inducing and exacerbating dry eye disease symptoms. Known risk factors for dry eye disease account for several disorders, including the ocular allergy and autoimmune diseases. The aim involves to study the prevalence of dry eye disease among the young population, and the proposed study was conducted over a period of 12 months in the Department of Ophthalmology, Himalayan Institute of Medical Sciences, Dehradun. It's an observational cross-sectional study with a sample size of 90. Study tools involve Whatman's filter paper, eye drop proparacaine, 0.5%, ocular surface disease index questionnaire, and sterile sodium fluorescence strips, along with slit lamp evaluation. The inclusion criteria: all patients between 7 to 17 years of age visiting the outpatient department of ophthalmology at Himalayan Institute of Medical Sciences, and patients with refractive errors. Exclusion criteria includes patients whose guardians do not give any consent, patients with a past history of any surgery or ocular disease, patients with active ocular surface disease, patients using contact lenses, and patients with history of systemic illness. The results include, firstly, gender distribution. In the age group of 7 to 12 years, we had 25 males and 15 females. In the age group 13 to 17 years, with a total sample size of 50, we had 26 males and 24 females. The frequency of Schirmer's test was as follows. In the 7 to 12 years age group, we had 80 eyes, out of which 2 eyes were in the category of 6 to 10 mm, and we had 0 in 11 to 15. 3 in 16 to 20 category, 21 to 25, we had 7 eyes, 26 to 30, we had 36 eyes, and 31 to 35, we had 32 eyes. In the age group of 13 to 17 years, we had 2, 1, 5 in the 16 to 20, and 9 in the 21 to 25, with an increasing number of eyes in 26 to 30 mm group. Next, we have the tear film breakup time. In this, we had 80 eyes in the 7 to 12 years category, and we had less than 10, we had 4 eyes, and in the category of 15 to 20, we had 14 eyes. 13 to 17 years age group, we had 81, which was 81 eyes that were included in the category of 10 to 14 seconds. Next, coming on to the frequency of the tear film height. In the age group of 7 to 12 years, we had 4 who had a value between 0.1 to 0.2 mm, and 76 with a value of 0.3 to 0.4 mm. And in the age group of 13 to 17 years, we had 2 with a value between 0.1 to 0.2 millimeters, and 98 with a value between 0.3 to 0.4 millimeters. Coming on to the CFS score that we calculated, 80 out of the 80 eyes, they were grade 0, 73 eyes, and grade 1, 5 eyes. Whereas in the 13 to 17 age group, we had none of the patients reported to be grade 2. The Worst scoring was as follows. We had 19 with a normal, 18 mild, 3 moderate, and no severe disease that was found. In 13 to 17 years, we had 30 normal, 17 mild, moderate, 3, and no severe dry disease was again reported. The ocular symptoms were as follows. The eyes that were sensitive to light, eyes that felt gritty, painful or sore eyes, blurred vision, and poor vision. Coming on to the visual functions that were assessed, one was difficulty while reading, driving at night, working with computers or mobile phones, and watching television. The environmental factors included windy conditions in places with low humidity, areas that are air conditioned. Now, the dry and refractive errors, we had 78 myopes, out of which the dry was present in 35 with a total percentage of 44.87%, and in hypermetropes with a sample size of 12, we had presence of dry eye in 41.66%. Discussion is as follows. Pragya Rao Donathnani conducted a cross-sectional study in which children and adolescents were considered as subjects, and visual morbidity was found was limited to those suffering with SJS. Rupal Bhatt, during the year 2016 to 18, calculated the prevalence of dry eye disease to be 6% in the 7 to 12 years age group, while Namrata Srivastav conducted an observational study to assess dry eye disease, and the disease entities were found to be associated with vernal keratoconjunctivitis conjunctivitis and overuse of smartphones. Xingrong Zhou et al. Conducted a systematic review which revealed the overall presence of dry eye disease symptoms in the myopic population to be 41.5%, and there was significant association between the two. Thank you.
Thank you.
On the tier meniscus height, we made a slit, and we had to orient the slit horizontally, and that is how we measured it. Like we made a 1 mm slit, and after that we can increase it because
So the height you measured was 0.1.
no, there was
It's
no.
mentioned in your slide.
That was the category, but the height that was which I found in my subjects was either 0.2 and more than that.
I'm not saying that. How did you measure 0.1? You have mentioned in your slide.
Ma'am, there were no subjects.
Can you show me the slide once again?
Yes, ma'am.
The tier meniscus height.
इनका स्लाइड ऑन कर दीजिए.
Yeah, here.
Yes, ma'am.
Height in millimeters or 0 to 0.1, 0.1 to 0.2, 0.3, 0.4.
Yes.
How did you measure that?
Ma'am, this was basically the range, but most the subjects that I measured, there the value of the tear film height was 0.2 or more than that, was more than 0.2.
No, I'm just asking a technical question. How did you measure it?
Ma'am, that
How
is,
did
we
you
made a
measure
slit
0.1? How did you measure 0.2? How did you measure 0.3?
0.3.
You have mentioned it here.
Uh,
In like this. It's 0.1 millimeter, 0.2,
Yes,
0.3,
ma'am.
0.4.
Ma'am, we made a slit, and through the
Yeah.
slit, we basically oriented horizontally,
Yeah.
and that is how we measured. And there are, it's the readings, the caliber is available, so 0.3, I was able to measure on the slit lamp.
Okay. Nice presentation. Slowly and surely it is getting established that even kids have dry eyes. But so many tests you have done, 7-year-old kid, reflex steering, whether the kid is cooperative or not. How do you actually say that all your values are actually true? Am I correct?
Yes. Sir, we took this particular age group from 7 to 17 years on purpose because usually kids below 7 years are all the more uncooperative. But yes, sir. But since because there is increased use of smartphones even in children who are as young as 5, so it was imperative that we included the younger children as well in the age group of 7 to 12 because the other age group is 13 to 17. So they are any which ways cooperative. But the younger age group of 7 to 12, they are relatively uncooperative. But it was important to include them as a part of my study because of the increased use of smartphones in that age group as well. So
One of your slides says driving at night.
for the, yes, it does. So,
Kids
sir,
driving.
in the OSDI score that I calculated, I have excluded that question in the patients who do not drive. Like in the age group of 13 to 17 years, there were a few children who did drive. So that question was pertinent for those candidates. So 13 to 7,
Okay.
yeah.
Thank you very much.